The department offers outstanding patient care, research, and training of the next generation of specialists in our field.
We value and nurture compassion, curiosity, innovation, integrity, and diversity. We are here to serve our patients, our profession, and our global community.
At Stanford, we have residents who really want to change the world for the better.
The resources at Stanford are unparalleled.
I love my co-residents.
No matter what I wanted to pursue and what I was interested in, like the opportunity was going to be here.
I felt like I fit in best with the residents that I met here.
I think ultimately it comes down to the people. You're working with them day in and day out, and it makes all the difference to have a crew that you love to be around.
We have an amazing group of residents and faculty, and the connections that I've made and friendships I've made and professional relationships I've made have been phenomenal.
The residents and the faculty here really were warm and invested in me as a person.
We have a really diverse patient population here.
In terms of age, in terms of race, ethnicity, in terms of like national origin, socioeconomic class. Like in one single day you may use like a Russian interpreter, Mandarin, maybe Vietnamese interpreter.
There's both basic science, translational, clinical research, as well as opportunities outside of what you might classically think of as a lab.
We really have strength across all subspecialties.
I partnered with engineers as well as students in the business school to come up with a device for the provision of hearing care for children in underserved communities.
I worked on leading 2 surgical imaging trials to improve head and neck cancer detection in the operating room as well as in the preoperative setting.
During my 3rd year of residency, I started a nonprofit that connects U.S. healthcare providers to patients abroad in order to provide them with free telehealth sessions.
Putting together the outstanding faculty, staff, and trainees in the department with the rest of Stanford and our healthcare delivery system establishes the foundation for building a truly remarkable department that we have here at Stanford and makes the future incredibly bright.
The breadth and depth of expertise in all aspects of our specialty, combined with the opportunity to do research in any area within otolaryngology, really are strengths of our program.
Having so many subspecialists and leaders in the field in so many different areas prepares you for going into any subspecialty.
Our department is lucky in that we have so many physician and surgeon leaders, both in the department but also in the hospital level.
Many of our faculty have important leadership roles in our hospitals, in our clinics, but beyond that, at the School of Medicine and at the university.
Dr. Sung will really go to bat for us. He's honestly like an amazing program director.
I think the best part of being the program director is just being able to make a really personal connection with the residents on a one-to-one basis.
I have called attendings at 2 a.m. and then had them teach me things over the phone.
It's been a pleasure to be able to work with residents and medical students and to be a part of shaping their careers.
Our mission is to train the leaders of tomorrow in the field, and part of that is to develop faculty members who represent the entire breadth of society and reflect the composition of not only just the Bay Area but the country in general. We want our residents to look like the people who are out there in the rest of the world.